everyone, I'm Sophia Cruz, nursing student from Charles College. So today I'm going to show you on how to administer intramuscular injection. But first, what is intramuscular injection or IM injection? It is a procedure wherein you will insert medication into the muscular tissue. Some medication cannot be taken orally because digestive juices can alter their effects. And some can be very irritating when they go into fatty tissues or veins. And also, this facilitates to a fast absorption and leads to a better outcome and effects. And the purpose of this procedure is to provide a faster rate of absorption than the subcutaneous route. And muscle tissue can often hold larger volume of fluid without any discomfort. So for the preparation, assess the client's allergies to medication, such as specific drug reactions, side effects, adverse reactions, and client's knowledge of and the learning needs of the client to the medications, and tissue integrity of the selected site, and client's age and weight to determine what needle is needed, and the client's ability to cooperate. So for the planning, assemble all the equipments and the supplies. First is we're gonna need the MAR or the medication administration record, ampule, needle that is gauge 21 or 22, but since I don't have 21 or 22, this is 23. And of course, a syringe, antiseptic swab or alcohol swab, gauze pad, and gloves. So next, check the label on the medication against the MAR carefully to make sure that the correct medication is being prepared. Follow the 3 checks on administering medication. Read the label on the medication when it is taken from the medication card, before withdrawing the medication, and after withdrawing the medication. And lastly, confirm if the dose is correct. So for the procedure, wash your hands first or sanitize your hands and observe other appropriate infection control procedures. Now that we already sanitize our hands, we're gonna use an ampule for drug withdrawal. So what are we going to do now is to withdraw the amount of medication that is needed. So for the implementation, introduce self to the client to establish rapport. So, good day ma'am, I'm Sophia Cruz, nursing student from Charles College, and verify the client's identity using the 2 identifiers. So, can I see your ID band, ma'am? Can you state your name?
Keisha.
And when is your birthday?
August 5, 2000.
Okay, and then prepare the client. So, upo po muna kayo ng maayos, then relax po muna ma'am, wag po muna kayo mag-cellphone. This is the appropriate positioning promotes relaxation of the target muscle. In selecting the site, it should be free of skin lesions, free from tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. So, there's no lesion, tenderness, or swelling in the skin. If injections are to be frequent, alternate sites, avoid using the same site twice in a row. And this is to reduce the discomfort of intramuscular injection. Now that I have put on my gloves, we are now going to clean the site with an antiseptic swab using a circular motion start at the center and move outward about 5 cm or 2 inches. In injecting the medication, hold the syringe between the thumb and forefinger, pierce the skin quickly and smoothly at a 90-degree angle, and insert the needle into the muscle. So, there, dart-like. Then, using a quick motion lessens the client's discomfort. So, hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. If the needle is in a small blood vessel, it takes time for the blood to appear. Aspirate for 5 to 10 seconds. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. This is the step to determine whether the needle has been inserted into a blood vessel. So, there's no blood. So, if bleeding appears, apply pressure with a dry sterile gauze until it stops. Discard the uncapped needle and attach syringe into the proper receptacle. Remove the gloves and wash hands. Document all relevant information and include the time of administration, drug name, dose, route, and the client's reaction. And lastly, assess the effectiveness of the medication at the time it is expected to act. So for the evaluation, conduct the appropriate follow-up such as the desired effects, any adverse reaction and side effects, and local skin or tissue reaction in the injection site. And then, relate the previous findings if available. And lastly, report significant deviation from normal to the primary care provider. And that's all. Thank you for watching. To cooperate. And I hope you...
my YouTube channel.
Naka-record.
Ay, naka-record ba? Sorry.